All right. Good evening, everyone, or good morning, whenever you're watching this recording. Thank you very much for joining us for our interview tip series brought to you by the TSMA. My name is Adam Ahmed. I'm the member of the TSMA Executive Committee. And today we're very, very lucky to welcome Dr. Rita Milewski on the call with us. Dr. Milewski is an associate professor of surgery at Yale University with a focus on educational, critical care, and mechanical support. She's the medical director of the Yale Adult ECMO program and has authored 3 chapters on ECMO management. She's also the program director of the Traditional Cardio-Thoracic Surgery Fellowship at Yale University. She was inducted as a member of the AATS in 2019 and serves on the TSTA Executive Committee as counselor and content writer for the in-service training exam and is the prior chair of the TSTA Early Specialization Committee. She also currently serves as a member of our TSMA Advisory Board. Thank you so much for joining us, Dr. Milewski. How are you today?
I am doing fine. And thank you so very, very much for inviting me on this interview tips program.
Thank you. I know you have a lot of insight for our students, so we're very, very excited to have you. So perhaps just to get us started, what general advice have you been given or would you offer students as they prepare for interviews these next few weeks?
Well, first of all, I want to say that all programs understand this is a very stressful time. It's a stressful time for all of the applicants. So one of the first things that I can say is to be genuine. Know what your strengths are. And if you're asked that, be sure to delineate what your strengths are and know what your growth areas are. I wouldn't say that you have any weaknesses. I would say that you have areas or growth areas. And the other thing that I would advise everyone is to know your application. Review the items that you put in your application so that you can answer any of the questions that they may ask you. For example, if you have low scores on a test, or if you applied last year and weren't accepted, or if there are any gaps in your education. Make sure that you're able to explain those. You don't want to go in with the attitude, oh boy, I hope they don't ask me this question. If you think of a question that may be asked on your application, prepare yourself for that. Prepare to be able to answer the question and go over that in your mind. So you don't want to be caught off guard in your application. You want to go in confident. And the best way to be confident is to anticipate anything that you may have to explain. For example, did you go from college and get a job first? And then went and applied to medical school? Is there a gap in your education because you took off time to have a family or something like that? If there's anything that is not going straight from going to high school, undergrad, medical school, right on, be prepared to answer that. It's not that it influences your application or influences the interview process, but again, you don't want to be caught off guard. And make sure you go through each program and know why you want to train there. So if the interviewer asks why you're a good fit, you can be honest and you can be specific, not general. So for example, you don't want, if they ask you, why do you think that you fit this program? You say, oh, I want an academic setting. That's way too general. Be a little bit more specific. For example, I want an academic experience because I'm interested in bench science, or I'm interested in big data research, or I have an educational focus and you have a strong program for that. Or if you want to get an additional degree, for example, you want to get a degree as an MPH or an MBA, or that there's a specific faculty member that you're interested in that area of cardiac surgery. So, you want to have some ways to delineate why you're interested in the program and being a little bit specific about that. And then also know the specifics of the program in and of itself, the faculty and the residents, and how they can contribute to the type of training you want and how you can contribute to the program as well. And again, you want to be specific, but not so specific that you're rigid. For example, I only want to do heart transplant. You don't want to go in and say something like that. You would want to be a little bit more general. You have a wide variety of types of procedures. And I also noticed that you have a very robust transplant program, and I'm interested in that. So If you want to tell them why you're interested in their program and there is a specific area, make sure that you bring in everything and then highlight the one area you might be interested in. And then I think, as Dr. Pereira pointed out in the last session that you want to have 3 to 4 genuine questions to ask the interviewers. And not just, how's life there or things like that. You want to ask something specific to their program, specific maybe to a specific faculty member or specific area that they have that maybe somebody else doesn't have. For example, perhaps the program has lung transplant. You want to ask specifically about that. So have 3 or 4 really good questions so that when they do ask you that these are good questions and they're not just coming off the top of your head. So that's some of the things. And then again, I think the most important thing, and sometimes you can pick up on this, make sure that you're being genuine and not trying to be rote, because it's easy to pick that up when somebody has a scripted thing in their mind. You want to be prepared. You want to have answers to specific questions, but you don't want to be rote. Okay.
Right. So attention to detail, your background, your aspirations, and
yes,
being yourself.
Yes.
All right. And we have some very specific questions that some students have struggled with in the past that I'd love to review with you. One of them you touched on a little bit already. How can students best answer, what are your strengths?
Okay. Yeah, it's a difficult question to try to talk about yourself. And again, you want to be somewhat specific. And because interviewers can be multiple different generations, my suggestion is not to use trendy verbiage. So, for example, you may have an interviewer who's in his early career or an interviewer who's been a full professor. So you want to use verbiage that delineates what your strengths are without utilizing trendy verbiage. And I will just give an example. Last year, I had several applicants utilize the verbiage that I have grit. Well, having grit may mean something to somebody who's 20 or 30 and something completely different to somebody who's 60. So be a little bit more specific without utilizing that trendy kind of verbiage. And you should also look at yourself and, try to delineate what kind of strengths you have that would align with the program, and also what would align with a multidisciplinary team. That's very important in medicine these days. Now, when I started training, it wasn't so important because we didn't have multidisciplinary teams. We had the surgical team that came by, we ran the unit, we ran the floors. That was it. But you want to delineate strengths that you have that would align with a multidisciplinary team and a multidisciplinary approach to medicine. So bring up strengths that you have that make you a team member, that make you align with the culture of being able to be a team member. You don't want to say, well, my main strength is that I'm a loner and I go rogue. So, that may be great if you're, in the military or, something like that, but it doesn't really align with medicine this day and age. So my main suggestion to you is to bring up strengths, again, that align with team approaches.
Right. And would you advise us to give examples as well as
Yes.
strengths? Okay.
Yes, absolutely give examples. Yes, absolutely give examples. And that's what we want to hear from you, because the examples make it personal. And that's how we want to hear how is your personal experience been able to make you someone who is going to work well within our team with our residents, because again, the residency program, the residents are all teams. What are your strengths that can align you with that type of thing, and be specific on how you are? Were you the captain of a football team or something that's one of my strengths. I have been a leader of a team. I have been, X, Y, and Z.
Mm. Wonderful. And another kind of diverting past a little bit, one question that comes up sometimes is tell us about an experience you had where you maybe disagreed with a colleague or a senior member of your team, and we're asked to give an example of that. How do we navigate a difficult question like that?
Well, you're right. It is a difficult question. And it's sometimes, I would say more often than not, comes with a specific scenario. So that you'll have to deal with the scenario as well. For example, you're at the patient's bedside or something like that. But and there isn't really a right answer for this, but again, I think Dr. Pereira in the last interview brought up an extremely important point that helps to answer this question. And one of the most important aspects or personality aspects that a person can develop as a surgeon or as a cardiac surgeon is emotional intelligence, both emotional intelligence and professionalism. Those are two key things that every person in the medical profession has to work on, especially this day and age. Again, when I trained, it was a little bit more coercive. Everybody was just in the surgical team and that was it. But now you have to approach medicine with multiple, with a different culture. So the ability to understand other people's point of views in a culture or an environment where other people's ideas are appreciated. So one of the major components of emotional intelligence is in the medical profession, is to have a conversation with the person you disagree with, away from the patient, obviously, and away from the team in and of itself. But it's always important to understand what the other person's point of view is. So you may disagree with the way that the senior or the attending approached the patient's medical therapy or the approach that they had to the patient, but you also need to ask that person when you're having the conversation with them why they took that approach. It may be that they have had a patient in the past who's needed that kind of approach to their medication, which is different than what's in the book or what that you've been taught in medical school. So you need to ask them why they took that approach. They may have a very specific reason, or why they approached the patients in a different personality or a different cultural approach than you may have done, that you may have disagreed with how they did it, but there may be a very specific reason. So you want to address that person and first of all, ask them why they had that approach. And then say, well, I may have approached it this way or that way, but I kind of see your point of view, or I want to get your point of view. So it's not appropriate to be dogmatic. That's not a part of emotional intelligence. You have to identify why they approached it that way. And again, find out, did they have a very specific reason? Again, as part of this team culture, this team approach to not only medicine, but a team approach to your colleagues. And I think that that's one of the most important ways to do it in real life. But that's an important way to approach any disagreement in medicine or in a team. You never want to bring it up specifically at that point, unless, obviously the patient's in harm's way, but you want to be able to take that conversation or that disagreement away from the patient, away from the team, and have a one-on-one conversation and try to understand the other person's point of view.
Wonderful, thank you. It sounds like this is really trying to gauge how you would be like as a team member, and the questions
Yes,
are really seeing how you would respond once you're a member of the teams.
right.
Wonderful. Okay. And another question we have. So this isn't a question per se during the interview, but the interview's over and the students are on the flight home or train ride home, and they're trying to assess how well the interview went. Are there certain ways an applicant could gauge a program's interest after the interview is over, and assess how well they did and make adjustments accordingly?
That in and of itself is another difficult a question to answer, but I do want to bring up some specific points that may help the applicants as they're going from one interview to another. So I think, again, Dr. Pereira brought up a very good point in the last sets of tips on interviews, is that the program wouldn't invite you for an interview if they aren't interested in you. Okay. So that is the one thing that you should always think about, after you've finished your interview. But just as there are many different programs, there are many different interview processes. And don't be surprised if you come up with come against or be exposed to, I should say, different interview processes. So it may be that one program has a one-on-one interview, one faculty member, one applicant. It may be two faculty members and an applicant, or a faculty member and a resident and an applicant. There may be scripted questions that the interview has to ask. So it may not be free form, or you may be in a program where each interviewer asks their own set of questions. Do you like to bake, or what do you do for, or there may be scripted ones that, in this situation, what would you do? So don't let the interview process in and of itself derail you. You're going to, I would suspect you are going to come up against different types of processes, different types of methodologies. So because there is so much variability, you should not come away from a specific interview thinking, oh, I really messed that up, or in the other sense, I did really, really well. Because there are always discussions after the interviews with multiple different people. So if you were having a difficult time with one interviewer, you didn't think you answered their questions well, or you hesitated, that does not mean that the interview did not go well. And again, by having multiple interviewers, that could be either brought up more, or it could be kind of diffused when there are discussions. So again, you need to go from one interview to the other. Just as I said in the first question at the beginning of this webinar, that you have to go into each interview confident. You have to go in prepared, and that's the best that you can do. And you can't come away from each one of them derailed. Oh, I did really bad. I did really bad. Because that may not be the case at all. And they did invite you because they were interested in you. The processes are different across each system. And there's no one way to say, okay, I'm going to check this box off, check this. I did this in the interview. I did this in the interview. I did well. Or the opposite, I did poorly. That may not be the case at all. So don't derail yourself and then go to your next interview thinking, oh God, now I've got to do it absolutely opposite because I felt so bad after the other one. You can't approach it that way. You have to go into each interview being confident and being prepared.
Right. That's very helpful to hear. There's no one size fits all
There is no one size fits all, and there's no way to absolutely gauge. There's no crystal ball. There's no formula to say that if I said X, Y, and Z, and that the interviewer smiled after each question, that I did well. That may not be the case at all. So you need to make sure that, again, it doesn't derail you. You go to the next one being confident, knowing your application, knowing the 3 or 4 questions you want to ask, and and knowing that you were asked to interview at that specific program, and that they're looking at you probably in a completely different light than the last set of interviews you had.
Wonderful. And then one of the last questions we had was towards the end of the interview process, as students are starting to make their rank order lists. What are your thoughts on scheduling a second look at programs that you're very interested in? And do you think there's a benefit, or could there be any harm in doing these?
Right. Well, one of the most important things that you have to realize and make sure that you call the program coordinator is that there are programs that the GME office does not allow a second look until the program has sent their rank list in. So if you feel that if you're scheduling your second look because you think that if you go there, that you may be able to make an impression or something like that, you must realize that there may be programs where that you're not allowed to come back until the rank list is already in. Those second looks are set up by those programs for the applicant's benefit. So they can come back and see, well, do I really want to go to this program? Do I really like this geographic area? Now, that's not all programs. So you need to first delineate that. The second thing is always, from my perspective, and again, this is my own personal opinion, have a specific reason that you want the second look. So if you're going to try to schedule it, make sure that you have a reason. You want to speak to a specific faculty member to find out a specific thing about the program in and of itself. You want to speak to the residents because you have specific questions. Identify the fit of the location. It's wise to go there with specific reasons and not just as a fishing expedition. So, you want to go there for your benefit as well. So make sure that, again, you find out if you can go and there's no, that they don't have to submit the rank list first before you go, and then have specific reasons that you do want to go.
Is there a way for students to delineate that on their own, or is that a direct question that they should ask at the end of their interviews about?
I would call the program coordinator. They will know. So that way you can ask them and find out that piece of information, and you'll know whether you can schedule a second look and what the timing is for that. Mm-hmm. And every program is different. So I would reach out to every program and find out that piece of information.
It's very helpful to know. Thank you so much. And we do want to be respectful of your time, and we're approaching the end of the interview. So I was wondering if you had any closing thoughts or advice for students as they go on this.
Yes. So again, I cannot emphasize more of being genuine and being prepared. Again, you want to make sure that you don't open up a door or don't answer a question and open up a door to something you can't answer. For example, if you're doing research and you say, we did this, I did this great project on, delineating the genetic components of the brain in the mouse. If you open up that door and you were a part of that, but weren't at the bench doing it, you have to be careful because your interviewer may actually be a geneticist. So if, and I'm not saying that you were being untruthful. I'm just saying that make sure that you are confident in your research. Or if you say that I've scrubbed into, 150 cardiac cases, an interviewer may actually ask, well, then what are the steps in a cabbage? So, make sure that if you state something like that, that you know what the next question might be. So you want to be sure that you know what's in your application. If your application says you do research, make sure you know all the components of the research that you did and what parts of it you did. If you put in your personal statement that I've scrubbed into multiple cases, make sure that you can delineate which cases you scrubbed in. No, sir, I didn't scrub into an aortic valve. I only did cabbages, but my understanding of a cabbage is, what. So you want to make sure you're genuine. You want to be confident, and you want to make sure that you know your application. And again, like I said, if there are any gaps in your education, you took any time off, there's any repeat of anything, that you know your research, everything that you have done. Make sure that you can delineate that because that's very, very important to be able to answer the questions that are asked of you.
Right. Wonderful. And thank you so much. This was all incredibly helpful and high yield insights for students. We really, really appreciate you sharing this with us. And thank you for your continued support of medical student education, Dr. Milewski. Um,
I want to thank you all for inviting me. I really do appreciate that.
Thank you. All right. And we'll get this recording for everyone out very soon. Thank you so much. And good luck to everyone interviewing this cycle.
Okay, thank you. Mhm.